So first, I think it's really important just to highlight some of the challenges that we are trying to address here. We know in New South Wales and Australia more broadly, we have come such a long way in terms of cancer outcomes. We are, across the world, New South Wales is a leader. Our outcomes are incredibly good and are increasing. However, the big caveat, the big however, is that this progress isn't shared equally. We know that there is unfairness, there's inequity, there are big, wide variation in terms of some hospitals and some people get incredibly positive and good results, whereas others, other areas and other the services that some people access, maybe they're doing things that could be improved. I've got two examples here which highlight this variation and highlights the fact that big, blunt policy from the top down can be really hard to address these local, regional issues. Okay, so I've got two figures here. The details aren't important. What the first figure here shows is, kind of the recommended therapies, a recommended therapy for early stage breast cancer. We see some hospitals up the top, 95% of the people get that recommended therapy, which is really good. But as we kind of go down the graph, we see that, there are some health districts where the proportion of people who get that recommended therapy is significantly lower, 7, 13%-ish, 1 in 4 people. So there's wide variation. The second figure shows kind of patient experience at outpatient cancer clinics. Again, we see really wide variation. We see some hospitals performing really, really well. Almost 100% of people say that their care was very good, whereas other hospitals, that is, markedly lower at, say, 70%. How we address these problems is challenging, and it cannot be done centrally through top-down policy reform. One of a strategy by which we can address some of this variation is from the ground up, from the local perspective, because it's that local perspective that understands the barriers, the local context, the context in which, and the local needs and preferences of the people that these health services serve. So, IOTA, it's a placeholder. The name IOTA is a placeholder for whilst we're thinking about this program. But why we need a program to, I suppose, enhance the capacity of local action is because of certainly we experience and we know that there is wide variation. We should be, hospitals and the services that do things really well, we should be learning from them. And the hospitals that are underperforming, we can help bring that up. There is a demand for consumer and community input into local health services. In fact, it's mandated for a public hospital to receive public funding. They need to demonstrate that they partner with consumers and communities. I think Anthony might touch on some of this later. There is really good evidence that when communities and consumers do partner and engage with their local health service, outcomes, experience is improved. Cancer Council, one of our values is innovation, and certainly this model, although not new, and Anthony will certainly kind of talk to their experience, there is huge scope for consumers and communities to better engage with their local health service, and we would love to be able to facilitate that. And it's also part of our organisational strategy is to improve survival and quality of life and improve access to the best care. Our ability to do that from the top down through statewide policy. We can do that through statewide policy. We can also achieve increasing survival by helping bring the hospitals and the services that have room to improve. We can help in that journey. Okay, so just briefly, in terms of local advocacy, everybody does something a little bit different, and we completely acknowledge how every region does something a little bit different. From listening to our community advocates over the last few years or so, big statewide campaigns were prioritised, over kind of developing those local connections and those local relationships. Some of the feedback we've had is that it can be really difficult to identify and prioritise issues. If a local area does identify an issue, it can be really hard to know how to address that. Some of the strategies by which we can, improve that. It can be difficult, and there is, limited engagement with local cancer services specifically across the state. So what we want to do is kind of come towards this future state whereby we are kind of evidence-based and we can, be guided by the data, and these data can help us identify issues in your specific local area. And we have lots of data sources which we'll go into at a later date. We would love our community advocacy, our community advocates to be health systems capable. By health systems capable, I mean have a good understanding of how hospitals work, how your local cancer service works, some of the challenges there around changing behaviours and improving quality and safety, for example. It's really complex, and it takes a specific set of skills and training to be able to be, I suppose, health systems capable. It would be great if our local advocacy networks were seen as a trusted partner of their local cancer service, for example. The local cancer service, it invites perhaps, our local regional advocacy networks to, join some kind of discussions, a round table. We are invited to participate in kind of prioritising issues. But we can also, as the local regional advocacy network, can reach in, and kind of help set an agenda or help set priorities. And we want to also be able to facilitate really good collaboration with your local community engagement, your local CPC who are here today. So this is basically what we are wanting to consider moving forward as another tool in the tool belt, that sits alongside, a lot of our established stuff, our MPL engagement program, for example, in our big statewide campaigns. What we want to be able to do is use the right strategy for the right issue.